Greetings, friends. Welcome back to my channel, To Be Well. I'm Joyce Strickland, your certified wellness coach with inspiration for your wellness journey. So I came across an article on CNN Health, and the article is entitled, Cancer Incidence Rising Among Adults Under 50, new report says, leaving doctors searching for answers. This article is based on a report from the American Cancer Society, and I've placed a link to the story in the notes below for your information. The article tells the story of a Josh Herting who was diagnosed with colon cancer 5 years ago at the age of 34. And we learn about Josh that after seeing blood in his stool, he went to the doctor, he got a colonoscopy, and he says that he was otherwise healthy. He was in the gym 4 to 5 times a week. He had low body fat and was in no pain. And in his words, he ate healthy. It turns out that cancer had been in his system for about 8 years when he was diagnosed with stage 3A colon cancer, and he underwent chemotherapy. For the next 5 years, the monitoring of Josh's monitoring included colonoscopies, CAT scans, blood work, and he was finally diagnosed as cancer-free 5 years later. But Josh says, and I quote, but you're never the same person. He still has some fatigue and numbness in his fingers and toes from the chemotherapy. And he gets colonoscopies every 3 years, we're told, unless the doctor says otherwise, to make sure the cancer has not returned. And we learn in this 1,800-word article many more details about Josh and his medical journey. But I have to tell you, and certainly so happy to hear that, to read that Josh is well and he appears to be healthy, and that story has a good ending. But I have to tell you that the closer I read this article and reread this article, the more questions I had. Because when we got into the meat of the story, to begin with, the article title, as well as statements repeatedly made in the text of the article, indicate a rise in colorectal cancer deaths in the age group under 50. However, the stats in this article, the stats that are referred to, the research that is referred to, do not support that age group. From the stats that are quoted, we are left wondering about cancer in the age group under 50. Because the statistical group for the quoted stats is for the age group under 55. And we have to ask ourselves, how many people under 50 have colorectal cancer? What is their death rate? What is the rate at which these deaths are increasing? You won't find those answers in this article, despite the title. The article does quote statistics for colorectal cancer and includes a bar chart showing where this particular cancer ranks among other cancers that are also rising. But those stats and the bar chart indicate an age group not under 50, but under 55. And I think this is problematic. And it's also, somewhat deceptive. For example, the new report indicates rates for some cancers, including colorectal cancer, increased by 2% from 2015 to 2019 for persons, again, under the age of 55. Which begs the question, what was the increase for those under the age of 50? Obviously, we would think it would be under 2%, so was it 1%? Did it increase by less than 1%? So we don't know from the information that's presented here. And of course, as a wellness coach, I read this article asking, what are the causes of the rise in cancer rate, whether under 50 or under 55? And so we're told, and I'm quoting from the article here, Up to 1/3 of people diagnosed before 50 have a family history or genetic predisposition. Now, I find this statement misleading. I find it misleading that the doctors or the researchers quoted here would conflate family history and genetic predisposition. Family history is not the same as genetic predisposition. Only a very small portion of cancers are caused by inherited gene mutations. The deaths wouldn't be 30%. And on the other hand, if we look closely at family history, this may lead to similar lifestyles, similar food choices, similar environmental factors if the family members live in the same place. You get my drift. So as a group, family history would dwarf the size of the group included in gene mutations as causal factors. These two factors apparently are conflated to give the wrong impression about the prevalence of genetic mutations as a cause. Further, the inference here is that family history, like gene mutations, are causal factors that you can't do anything about. I mean, it's your genes, it's your family, and these can't be changed. Now, what can we do to reduce the rise in colorectal cancer deaths? I mean, that's another burning question I had as I read the article. Quoting from the article, they say, we need to halt and reverse this trend by increasing screening with follow-up care in persons 45 to 49. Okay, screening is important for detection, but what about true prevention? What about diet? What about exercise? These are summarily dismissed. This article contains over 1,800 words, and the word prevention appears among the final 200 words, and it appears 3 times, as we are told. As a nation, we've dropped the ball on cancer prevention, that progress is lagging in cancer prevention, and that we need an increased investment as a nation in cancer prevention. Nor do we learn what these experts mean when they use the word prevention, but I'll come back to that. Now, these statements about prevention come from persons associated with the American Cancer Society, and in fact, the report referenced in the article is from the same organization. Well, when we look at the American Cancer Society, of course, part of their stated mission is cancer prevention. Their annual revenue is $700 million. Their total assets exceed $1 billion. The COO's salary at the American Cancer Society is $1 million. And these doctors are at a loss as to what is causing the 2% rise in colorectal cancers in persons, again, under the age of 55, as they represent the organization. Now, one of the experts tells us, and I quote, persons with genetic predisposition or family history should begin screening before age 45. This statement exposes the true agenda here. We get to the real nitty-gritty. The purpose of this article, as I see it, is first to raise alarm about colon cancer in persons under 50. Josh is only 34. He's healthy by all accounts, and if he can get it, you can get it. And by deceptively using stats for persons under 55 instead of under 50, the problem is made to appear more dire than it actually is. The things you can't do anything about, family history and genetic mutations, those lead the list of possible causes. And so why raise the alarm? Well, to promote cancer screening. Cancer screening is promoted as the only positive thing you can do when it comes to cancer. Josh emphasizes cancer screening. Cancer screening is emphasized in several quotes from the experts. And cancer screening is big business, as we know. Cancer treatment is even a bigger business. Prevention, well, there's no money in prevention. To be diagnosed and treated and sometimes die from cancer in any form, well, this is a horrible thing, and we need to acknowledge that. I lost a sister recently to breast cancer. Screening is how we detect cancer. But shouldn't we be doing something, everything in our power, in fact, to prevent cancer in the first place? Even though the article dismisses prevention, I feel it's important to understand what the medical industry means, the sick care system, what they mean when they use the word prevention. When you and I speak of prevention, we mean health promotion and disease avoidance, okay, obviously. However, according to the National Institutes of Health, prevention activities are typically categorized by three definitions. There's primary prevention, secondary prevention, and tertiary prevention. Primary prevention is what we would actually call prevention. This is when we keep the disease from ever occurring in the first place. Secondary prevention, though, is actually screenings. So screenings are secondary prevention. And tertiary prevention, you could probably guess, well, that's surgery, rehabilitation, and I would assume, prescription drugs and the like. So the National Institutes of Health, their budget for 2023 was over $49 billion. Their mission is to seek fundamental knowledge about the nature and behavior of living systems and to apply that knowledge to optimize health and prevent or reduce illness for all people. And according to the National Institutes of Health, a government agency, all activities of the medical industry, everything the sick care system does, can actually be called prevention. While you and I know that advocating for and working for disease avoidance is practically absent from the sick care system. Obviously, I'm not a physician. I have no medical training. You always want to consult your healthcare provider for your medical needs. Screening certainly has its place. It is critically important in disease detection. However, cancer screening is not prevention because cancer screening does not prevent cancer from occurring. Let me repeat that. Cancer screening does not prevent cancer from occurring. And shouldn't the prevention of cancer be our ultimate goal? True prevention may not be the goal of the sick care system. True prevention may not be a substantial part of the budget of any government agency or the sick care system or a multi-million-dollar health advocacy organization. Therefore, prevention can and must be your goal. And you should know that there is research. There are scientifically proven ways to prevent cancer or reduce the chances of contracting cancer, including colorectal cancer, and as a matter of fact, including any chronic disease. But those methods of prevention are conspicuously absent from the article in question. Therefore, I want to call your attention to this website from the Harvard Medical School, and here we find 10 commandments of cancer prevention. And there are 10 commandments here. I won't go through all of them, but you can see them there. And I have a link to this website. And it's just one of many, many, many sources that can help you on your journey to cancer or disease prevention, because that has to be your goal ultimately. Now, the first commandment here is obvious: to avoid tobacco in all its forms and, of course, secondhand smoke. But number 2 and number 3, well, this is your sweet spot here. You need to eat properly. And eating properly means that you're going to reduce your consumption of saturated fat and red meat, which increase the risk of colon cancer. There you see it. And a more aggressive form of prostate cancer. Also, eating healthily will mean increasing your consumption of fruits and vegetables and whole grains. And I would add, the site doesn't say that, but I would suggest that your plants, the plants that you consume in your diet, should be organic, because otherwise you're exposing yourself to carcinogenic herbicides and pesticides, and we don't want that. We don't need that. And the third commandment there is to exercise regularly, because physical activity has been linked to a reduced risk of colon cancer, not to mention other types of cancer. So there you have it. Now, in closing, I want to encourage you to read health articles, and because you want to be informed, you want to know what the science is saying lately, because science is constantly changing, especially when it comes to the connection between diet and cancer or other chronic diseases. This is a moving target, so you want to keep up with that. But when you read these articles, I'm going to suggest that you be sure to read with discernment, that you ask yourself, what's being promoted here? Do the stats support the premise? And I want to leave you with a quote from Calley Means, who is a former advisor to politicians and prominent food and pharma companies. And he has founded his own company, TrueMed. There's a link below to a podcast in which Calley was interviewed, so that you can listen to him and learn more about his work. But his company proposes to expose and change the food industry's causing alarm, from which the health industry is profiting heavily. And Calley Means says, cancer, Alzheimer's, heart disease, obesity, autoimmune conditions, these are all going up, and they're all foodborne illnesses. And by foodborne, he means that they're caused by the foods we eat. And the fact that there is not clear communication about that from our medical leaders and our public policy leaders, I think is the biggest scandal in America and the most dangerous scandal. That's from Calley Means. In closing, I would remind you, especially as relates to cancers, screening is important in detecting and diagnosing the presence of cancer in your body. But screening for cancers does not prevent cancer. This is Joy Strickland, your certified wellness coach. I'll see you next time.